In a video we did a while back, we looked at how many doctors have death anxiety because death is seen as a failure in their profession. In this video, we're looking at nursing staff and their struggles with death anxiety, which again has been studied extensively throughout many countries. So why is it so common for nursing staff to have death anxiety when the general public would assume that they are one of the last groups to struggle with it? Before we begin, we post death and dying related videos every Friday, so if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk nurses and death anxiety. This is a topic that I've done many workshops on with nursing staff. I also know many people who are nurses and in various medical professions. And if there's one thing I've learned, it's that ego and saving face is a big deal in this profession. They will rarely admit that they struggle with this to themselves, and certainly not in front of their colleagues, which is sad, but I think understandable, all things considered. So to any medical staff watching this, please know we have online consults available if you want to chat about any of these issues that you are having in private. Our website is in the description. Okay, onwards. Lack of training. Much like doctors, the many years of training nurses received is packed full of training and information to keep patients alive, obviously. And years ago, I started chatting to friends and families who are nurses about what they learned at uni regarding death or advanced care directives or voluntary assisted dying and things like that. To which the majority responded with something like, well, I think it was briefly mentioned in one lecture. So me being the curious person I am, got a copy of every course's curriculum from every uni and TAFE in Australia with a nursing degree of some kind. And yes, it took almost 2 years. They're really not forthcoming unless you're already enrolled. And lo and behold, there is virtually nothing in these curriculums that may psychologically prepare trainee nurses for a patient dying, whether it be through trauma in the emergency department or a heart attack in a different department. And yes, we are obviously excluding specializations of palliative and hospice care here. When I started doing workshops with medical staff some years ago, it was even worse than I thought because many didn't even know what an advanced care directive was or what to do with it. And in the past few years, many weren't even aware that voluntary assisted dying laws have been put in place, let alone how a patient would go about accessing it. And when we talk about death anxiety in nurses, let's be clear, we are not blaming the nurses for this. They are human, they have the same propensity for death anxiety and anxiety about the mortality as everyone else. And I blame the training providers. It's not just that they're not preparing them for patient deaths, they're not even mentioning it at all. Direct exposure to suffering. Nurses are on the front lines of patient care, often witnessing patients in pain and distress. Doctors are taught that death is a failure, so they do everything they can to keep the patient alive no matter what. But if you've ever been in hospital for a long period of time, you'll know that you may see that doctor for 5 minutes, maybe once a day if you're lucky. They aren't the ones seeing you suffering. But the nursing staff have to carry out whatever brilliant plan the doctor thinks is best. And therefore, they do see the suffering, day in, day out. And that shit stays with you. You realize that if you end up in the same predicament as this patient, you will be at the mercy of some doctor who may or may not have your best interests at heart. Emotional bonding with patients. Nurses can develop strong emotional bonds with their patients, especially if they've been caring for them over extended periods of time. Witnessing the decline and eventual death of patients they have grown close to can be emotionally distressing and contribute to their anxiety. Many nurses who are parents report having to deal with child patients to be extremely difficult, especially when that patient doesn't pull through. Others say that every now and then there will be a patient who reminds them of a loved one, or who is particularly charming or likable, or whose situation seems particularly unfair, whose demise weighs heavily on them. Again, nurses are human, and seeing mortality on a regular basis is a challenge, particularly if you are a very empathetic person. Ethical dilemmas. Nurses may encounter ethical dilemmas related to end-of-life care, such as decisions about withholding or withdrawing life-sustaining treatment, respecting patient autonomy, and balancing the wishes of patients with the goals of medical care. Navigating these complex ethical issues can be stressful and contribute to their anxiety. The video we did a while back on the TV show Chicago Med highlighted exactly this, the ethical issues and how they are seen differently by doctors and nursing staff. On one side, life over quality of life, and on the other side, quality of life and care. It is the nursing staff who deal with the feelings of patients and families, their frustrations and pain. Not so much doctors who have a different objective and see patients as a problem to be solved, and a Rubik's Cube doesn't have feelings or pain. Personal coping mechanisms. Another part of all this is the trauma junkie, of which police, firefighters, paramedics and nurses will all admit to being. You don't believe me? Check out one of their private Facebook groups. I even bought a family member a hoodie that reads trauma junkie. It's not that I want you to get hurt, I just want to be there when it happens. This isn't necessarily a bad thing. It gives them motivation and makes them good at their jobs. But their fix is also kind of a game, a problem to be solved against the clock. And when that doesn't work out and the game reads game over, well, that adrenaline crashes. And without proper coping mechanisms in place, that sudden crash can lead to guilt, anger, or depression. Nurses and these other professionals often have their own fears and anxieties about mortality, which can be triggered and amplified by their experiences in the healthcare setting. And the longer they go on without proper coping mechanisms, the bigger the negative consequences. There are a lot of stresses in a job like nursing. Low pay, ridiculous hours, little support, limited resources, too many patients, the list goes on and on. And while I acknowledge that training someone from scratch in as little as 3 to 4 year period doesn't leave much room for learning more than the basics, the lack of acknowledgement that patients will die is very frustrating. It's like preparing someone with the many styles of swimming and then telling them to jump in the tank, but forgetting to tell them that it's full of sharks. A heads up seems warranted. Which is why we started hassling unis to let us speak to their nursing students. And so far, students seem to have appreciated it. Now, we haven't discussed here how death anxiety impacts their work or personal life, nor have we spoken about how to combat the issue. These are topics for another video. But as always, if you have questions, leave them in the comments. And with that, go talk death.